So, period blood color trying to tell you something about your health. From brown to black, pink, or red, all these color changes can sometimes freak you out. Hi there, I'm Dr. Natalie Azar. Welcome to Know Your Health with Dr. Natalie Azar. And in today's video, we're going to be talking about the different period blood colors. First, let's talk about the brown period blood. Brown period blood is blood that has been oxidized, meaning it has reacted with oxygen. You will commonly see this color of blood at the beginning or at the end of your periods. This is blood that takes a little longer in your uterus or takes more time to come out of your vagina. For example, when you have your periods and you remain lying down for a long time, blood can collect in your vulva or vagina. The more it remains there, then this blood reacts with oxygen, which changes its color from red to brown. This blood color is generally normal, but it becomes a concern when it has a bad odor, when you feel burning sensation or pelvic pain. Then in this case, you should see your doctor as soon as possible. Let's talk about another period color, which is black. And you're more likely to see this if you're somebody who suffers from heavy periods because the endometrium can break away in chunks which pile together and look as if it is darker, but in real sense, it's actually red. So when is black period blood considered as abnormal? One is that when your entire period, from the start throughout to the end, you have been bleeding black blood. Two is bad smell, when your menstrual blood has a very bad odor. Others can be when your period blood has lots of clots and it comes at irregular timing. Then you need to see your doctor as soon as possible. So let's talk about pink period blood. Pink period blood happens when you have very light flow, for example, at the beginning of your period. And this just means that the blood has been diluted. Blood can be diluted by vaginal discharge or cervical fluid, and this is completely normal at the beginning of your period. But if this continues up to day 2 or day 3 of your period, then this can raise a concern. Pink period blood abnormally happens when you have high or low estrogen levels, when you are anemic or you have less nutrients in your diet. So when this pink period blood persists up to day 2 or day 3 of your menstruation, then you need to see your doctor immediately. Now, let's move on to the color which you're more familiar with, which is red. You will normally see this color in the middle of your period, and it just means that the blood is coming out at a steady rate. It's not slow, and it hasn't had the chance to be oxidized. Bleeding red blood is okay, but it does not necessarily guarantee you that red blood is normal because you can bleed from the cervical poly, which is red. You can also bleed in between your periods, which can be due to a number of causes. You can also bleed after sex, and this is also red. So not every vaginal bleeding is period. Take note of that. In other words, if you detect any abnormality during your period, then you need to see your doctor immediately. I hope this answers some of your questions about period color. And in case you have any other questions about periods, then feel free to write it down in the comment section below, and I will not hesitate to answer all your questions. And if you've watched this video up to this part, don't forget to like and subscribe to this channel because you wouldn't want to miss out on the next video. I remain Dr. Natalie Azar, and this is Know Your Health with Dr. Natalie Azar. Thank you for watching. Till next time, bye. This can be a little bit alarming. Let's take a scenario. When you go to the restroom and you want to change your pad or tampon, and then you notice that your period blood is black. And then you'll be like, did that just come out of me? Actually, this black period color can happen due to a number of reasons, which can be normal or abnormal. The normal reasons can be due to the menstrual flow rate. If your menstrual flow rate is much slow, which normally happens at the beginning or at the end of your period, the blood can appear dark. This is because the blood takes a longer time on the way before it comes out of the vagina, and this gives time for the blood to react with the oxygen, which eventually becomes darker than usual. Another reason is that black blood can be as a result of shedding of the lining of the uterus, which is an endometrium, during your period.